Chronic pain can change your entire life, and it affects how you relate to your family and friends. Taking control of pain was the focus of our conversation with noted pain specialist Dr. Andrew Hesseltine from Redlands Community Hospital.
We see really anybody that has a chronic pain. If someone has a short pain, if they fall, you break your arm, that's a new onset of a pain, they're going to go to a different type of physician. But if you have some type of pain that doesn't go away after you would have expected it to heal, then it's considered a chronic pain, and then it comes under my type of umbrella. But we really treat all types of chronic pain, headaches, pelvic pain, abdominal pain, but the most common, if you had to pick one typical patient, it would be someone with chronic back pain.
Are these pains genetic in nature or caused by trauma?
It's a combination. We have people on the trauma side, or in this area, it's the motorcycle wrecks and the dune buggy wrecks out in the sand dunes and that, or the industrial injury, someone lifting a box and then herniating a disc. On the other side of the spectrum is someone that is elderly, maybe has worked hard their whole life, a plumber or someone that likes to golf, and they've just developed arthritis in the spine. And that's a combination of partly genetics and partly just the mechanical forces you've put on your back.
We asked Dr. Hesseltine, when should a person see a doctor?
If it's just a nagging kind of mild pain that doesn't stop you from doing the things you want to do, it probably doesn't need to be addressed in a chronic pain clinic. Probably your family physician can take care of it. But if it's gone to the point where you have some type of condition or pain that is starting to, prevent you from going to golf. When your friends call you and say, let's go play 18 holes, and you say, my back I'm going to pass. I'll meet you guys later for dinner. That means now this pain is interfering with your life, and that's at a point where you need to come and see a specialist and see if they can make your life more active.
The doctor told us how a diagnosis is made.
We also use the advanced imaging studies to, when the indications are right, we'll send someone for MRI and CT scan, and x-rays and blood tests and that. But, and then the physical exam can also point you to where you think the specific problem is coming from. But if I had to just pick one, it would be the patient's history. I can usually figure out where the pain is coming from just based on what they're telling me. The kind of things I can offer somebody for instance, with chronic back pain, it's pretty diffuse. It depends. We try to get their comfort level, and part of it depends on what they've tried in the past. But sometimes it starts with something minimally invasive like acupuncture. There's topical medications, there's topical electrical stimulators that we can use to control certain types of pain. There's therapeutic injections. And we can burn small branches of pain nerves to get pain relief longer in the spine. And really the higher tech thing is something like spinal cord stimulation, where we can use an electrical implant, sort of like a pacemaker, but instead of a pacemaker for the heart, it's a pacemaker for your spinal cord. And we can use electricity to control a lot of different pain with that.
And how successful are these pain treatments?
If you have realistic goals for each person's situation, I would then say we're probably 80 to 90% successful in reaching those goals. But if you try to set the same goal of, okay, we're going to get everybody back to golf and everybody back to work, well, then our success rate isn't very high. But someone that's had a severe trauma and they've been, fused from their neck down through their tailbone and just have been living in chronic pain for 20 years and they're severely impaired, well, their goal may just be saying, if you could get me to go to the grocery store and back without severe pain, then I would be happy. Someone else who's just recently developed pain and they were previously boxing or a professional athlete, well, their goal is, you better get me back to function at an extremely high level.